Bone joint contracture, often simply called joint contracture, is a medical condition characterized by a significant decrease in the normal range of motion of a joint. This condition can be quite debilitating, affecting a person's ability to perform everyday activities and significantly impacting their quality of life. This reduced flexibility occurs when the usually soft and pliable tissues around a joint, such as muscles, tendons, and ligaments, become tight and inflexible, leading to a restricted range of motion. These tissues, which normally allow for smooth and fluid movement, become rigid and less elastic, making it difficult or even impossible to fully bend, straighten, or rotate the affected joint. This can result in significant discomfort and pain, further limiting the joint's usability. Imagine a door hinge that has become rusty and stiff. It becomes difficult to open or close the door smoothly. This analogy helps to visualize how joint contracture affects the body's joints. Similarly, in joint contracture, the hinge of the joint loses its smooth movement. The joint becomes less functional, much like a rusty hinge that needs oiling. This condition can affect any joint in the body, but it is most commonly observed in the larger joints, such as the shoulders, elbows, hips, and knees. These larger joints are crucial for many daily activities, making contracture in these areas particularly impactful. The severity of contracture can vary widely from person to person. Some may experience only minor stiffness, while others may face severe restrictions that greatly hinder their mobility. Some individuals may experience only mild stiffness, while others may have severe limitations in movement, impacting their ability to perform everyday tasks like walking, dressing, or reaching overhead. These limitations can lead to a decreased quality of life and increased dependency on others for daily activities. Joint contracture is not a disease in itself, but rather a symptom or consequence of various underlying factors or conditions. These can include prolonged immobility, neurological conditions, or injuries that lead to scar tissue formation. It can develop gradually over time or occur relatively quickly depending on the cause. Early detection and intervention are key to managing the condition effectively. Understanding the causes, symptoms, and treatment options for joint contracture is essential for early detection, effective management, and the preservation of joint health and mobility. With proper medical care and rehabilitation, many individuals can improve their joint function and lead more active lives. Joint contractures can arise from a variety of factors, often stemming from a lack of regular movement in the affected joint. One of the most frequent culprits is inactivity, which can occur due to prolonged bed rest, immobilization after an injury like a fracture, or a sedentary lifestyle. Another common cause is injury to the joint itself, such as a fracture, dislocation, or severe sprain. These injuries can lead to inflammation, pain, and swelling, which, if not properly managed, can cause the surrounding tissues to scar and contract. Certain medical conditions can also increase the risk of developing contractures. Arthritis, particularly osteoarthritis and rheumatoid arthritis, is a major contributor. These conditions cause chronic inflammation and damage to the joints, leading to pain, stiffness, and eventually, contractures. While anyone can develop a joint contracture, certain factors can significantly increase an individual's susceptibility. Age is a key factor, as the risk of contractures increases with age. This is primarily due to the natural wear and tear on joints over time, as well as age-related changes in muscle and tissue elasticity. Certain medical conditions, apart from arthritis, also elevate the risk. Neurological conditions such as stroke, cerebral palsy, and multiple sclerosis can disrupt the communication between the brain and muscles, leading to muscle weakness, spasticity, and ultimately, contractures. Other factors that can contribute to contracture development include burns, which can cause skin and underlying tissue to tighten and contract, genetic predisposition, and malnutrition, as inadequate nutrition can weaken muscles and tissues, making them more prone to contractures. Recognizing the early signs of a joint contracture is crucial for timely intervention and better treatment outcomes. A contracture occurs when the muscles, tendons, or other tissues around a joint become tight or shortened, limiting the joint's movement and flexibility. One of the most noticeable symptoms is a decreased range of motion in the affected joint. This can make everyday activities, such as reaching for objects or walking, more challenging. This means you may find it difficult to fully bend, straighten, or rotate the joint compared to your other healthy joints. Over time, This limited movement can lead to muscle weakness and further complications. Another common symptom is stiffness in the joint, especially after periods of inactivity, such as sleeping or sitting for an extended time. This stiffness can make it hard to get moving again after resting. This stiffness usually eases with movement, but it can be a warning sign of a developing contracture. Gentle exercises and stretching can sometimes help alleviate this stiffness. Pain is another symptom, although it's not always present in the early stages. When pain does occur, it can be a sign that the contracture is progressing. As the contracture worsens, you may experience pain, particularly when trying to move the joint beyond its limited range. This pain can interfere with daily activities and reduce your quality of life. The pain can range from mild to severe and may be accompanied by other symptoms, such as swelling, warmth, or redness around the joint. These additional symptoms can indicate inflammation or other underlying issues that need medical attention. Section 5. Contractures in daily life. The impact on mobility and independence. The impact of joint contractures on daily life can be significant, depending on the severity and the affected joint. Even mild contractures can make everyday activities more challenging, while severe contractures can severely limit mobility and independence. For example, a contracture in the hip can make it difficult to walk, climb stairs, or even get in and out of a car. A contracture in the elbow can make it challenging to reach overhead, carry objects, or perform tasks like brushing your hair or dressing yourself. In more severe cases, joint contractures can lead to a loss of independence, requiring individuals to rely on assistive devices like canes, walkers, or wheelchairs for mobility, or assistance with daily tasks like dressing, bathing, and eating. Section 6. Treatment options, restoring mobility and function. The primary goal of treating joint contractures is to improve or maintain the joint's range of motion and reduce pain and stiffness. This is crucial for enhancing the patient's quality of life and enabling them to perform daily activities with greater ease. The specific treatment approach will vary depending on the severity of the contracture, the underlying cause, and the overall health of the individual. A personalized treatment plan is essential for achieving the best possible outcomes. One of the cornerstones of treatment is physical therapy, which typically involves a combination of stretching exercises, range of motion exercises, and strengthening exercises. These exercises are tailored to the patient's specific needs and abilities. These exercises are designed to gradually lengthen the shortened tissues, improve flexibility, and strengthen the muscles surrounding the joint. Consistency and patience are key to seeing significant improvements over time. Medications may also be used to manage pain and inflammation associated with the contracture or the underlying condition. These can provide relief and make it easier for patients to participate in physical therapy. Over-the-counter pain relievers like ibuprofen or naproxen can be helpful, offering a convenient option for managing mild to moderate pain. While in some cases, stronger medications like corticosteroids may be prescribed to reduce inflammation. These are typically used when over-the-counter options are not sufficient. Section 7. The importance of early intervention, preventing long-term complications. Early diagnosis and intervention are paramount in managing joint contractures effectively and preventing long-term complications. When addressed early on, contractures are often more responsive to conservative treatments like physical therapy and medications. Early intervention can help prevent the contracture from worsening and potentially becoming permanent. As a contracture progresses, the affected joint can become increasingly stiff and painful, making treatment more challenging and less effective. Moreover, untreated contractures can lead to various complications, including chronic pain, muscle weakness and atrophy, joint deformities, and limitations in daily activities. Section 8. Case studies, real-life examples of contracture diagnosis and treatment. Let's look at a couple of examples to illustrate the importance of early intervention. Sarah, a 65-year-old woman, developed a shoulder contracture after a fall that resulted in a fractured arm. Due to the pain and immobilization during the healing process, Sarah's shoulder became stiff. Initially, she dismissed it as post-injury stiffness, but when the stiffness persisted even after her fracture healed, she sought medical attention. Through a combination of physical therapy and pain management, Sarah was able to regain a significant range of motion in her shoulder, allowing her to resume her daily activities without major limitations. Section 9. Prevention and consultation. taking charge of your joint health. While not all joint contractures are preventable, there are several steps you can take to reduce your risk and maintain optimal joint health. Regular exercise, including stretching, range of motion exercises, and strength training, is crucial for maintaining joint flexibility and muscle strength. If you experience any joint pain, stiffness, or limited range of motion, it's essential to consult a healthcare professional promptly. Early diagnosis and treatment can make a significant difference in preventing contractures from worsening and preserving your mobility and independence. Remember, your joint health is in your hands.